The conventional medical approach to chronic diseases is with drugs or medication to control symptoms and possibly to control or prevent complications from the disease. For example, if you had an osteoarthritis or a degenerative arthritis, the conventional medical approach would be to give anti-inflammatory drugs to suppress the inflammation and potentially down the road a joint replacement if the joint gets badly deteriorated. Naturopathic approach to chronic disease is quite different, actually, and what naturopath will do is first and foremost try to look at what the underlying factors are for why the conditions are there that cause the arthritis. Naturopathic doctors believe that in balance the body has an incredibly powerful innate ability to heal itself, and if you give it a chance, it can heal. It can restore balance and wellness and health. So the naturopathic physician will work with the patient to try to understand what are the conditions, what are the underlying causes, what are the obstacles to cure that can be identified and removed so that that person's body can do what it wants to do naturally, which is to heal. Secondly, a naturopathic physician will look at and provide interventions that are the least force possible so that we don't overshoot the mark and do more damage or do harm to the patient rather than good. So the interventions we use will follow what we call a ladder of intervention or a therapeutic order. We'll use the most simple, non-invasive techniques first and move up that ladder of intervention only as necessary. And then lastly, I think a big difference with the naturopathic approach to chronic disease is the concept that the doctor plays a critical role in educating or being a teacher for the patient to help them understand what's wrong and help them figure out ways that they can feel better and get better.